We're going to address the muscles of the lower limb in this PowerPoint presentation. These muscles are designed to move the hip joint, the knee joint, the ankle joint, and the toes. We will discuss in short details most of the muscles, but we will concentrate in more details for other important muscles. In case you feel that your voltage for learning is getting less, especially when you do lots of efforts and then your mark is not satisfactory to you, that means there is something wrong. And just in case your voltage is getting lower, let us depend less on memory and more on intelligent way of learning. One of the basic facts that we should follow in our university life is that we should not study hard. We should study smart. We should use our intelligence in gaining our information, and we should depend less and less on our memory. Let us recharge our ability to learn and to understand. Always ask questions. Minimum is 5 questions, and ask yourself these questions before others ask you, like before the exams ask you, and get answers. And if you do that, you can learn a lot. This is a basic fact of learning, and there are more questions than answers. Nowadays, in the 21st century, science in every aspect is everywhere. It's on your phone, it's in your house, it's in the university, it's in a cafe. Science is very widespread, and within minutes you can gain at least 5 basic facts about anything. Even if you want to boil an egg, just go to the net and search what's the best way of boiling an egg, and within minutes you get the very basic facts and the best of them. Now let's do business. What is this muscle? We can see that this muscle is taking origin from the lumbar vertebrae and the 12th rib, and as the muscle comes down, it crosses the hip joint and inserts on the lesser trochanter of the femur. So this is a very efficient, very good, very strong muscles in flexing the hip joint, and it is called the psoas muscle. As you can see, the pronunciation is missing the P. The P is not pronounced. This muscle is coming from the iliac fossa, the inner surface of the ala of the ilium, and it is crossing anteriorly the hip joint, and it is inserted into the lesser trochanter of the femur. This muscle is a flexor of the hip joint, and it is called the iliacus because it takes origin from the iliac fossa. Now we know that the psoas muscle is a flexor of the hip joint, and so is the iliacus. Now both of them, they insert on the lesser trochanter of the femur after crossing the hip. Now this is what is going to happen as the psoas muscle comes from higher up in the lumbar region, and the iliacus coming from the iliac fossa. They form a joint tendon, and they insert together on the lesser trochanter. Therefore, two muscles have at the end one tendon, and it is called the iliopsoas tendon. As you may have noticed, now we are in the posterior part of the hip, and this area is called the gluteal area, and we can see that this muscle is coming from the iliac crest, the sacrum, and the lower part of the vertebral column, the coccyx as well, and it inserts into the gluteal tuberosity of the upper end of the shaft of the femur. And here are the facts repeated again. Comes from the posterior surface of sacrum and coccyx and inserts into the gluteal tuberosity of the femur, and because it is posterior to the hip, therefore it extends the thigh. This is very important muscle because it is the most powerful extensor muscles of the hip. Why is that? Because when you are sitting on a chair and you want to stand up, you are going to need to extend your hip to move the thigh posteriorly, so you are going to use this muscle. Plus, when we are walking and we want to push ourselves forward, we are using this muscle. Now, this muscle is in the gluteal region, and it is the largest muscle in the gluteal region. Therefore, it is going to be called gluteus maximus. Now, the gluteus maximus is acting on the hip joint, and it extends the hip joint. Extension of the hip joint is going to make us able to stand up and makes us push ourselves forward in walking. Here is another muscle which is deep to the gluteus maximus, and it is called the gluteus medius. It is coming from the external surface of the ala of the ilium, and it is going down and anteriorly to insert into the greater trochanter of the femur, and this is going to abduct the femur, moving the leg away from the midline. We're still in the gluteal area, the outer surface of the pelvis, and we have a third muscle which is the deepest, is deep to gluteus medius, and this is called the gluteus minimus, and it comes from the gluteal lines on the outer surface of the ala of the ilium, and it is going to insert into the greater trochanter of the femur, and it abducts the femur, and of course it abducts the hip joint, and this is the same action as gluteus medius. Here are the gluteal muscles that will act on the hip joint, and the most posterior and the largest is gluteus maximus, then anterior to the gluteus maximus is the gluteus medius, and then it is the gluteus minimus. Here is a muscle on the medial side of the femur coming from the pelvis, and this is the pectineus muscle because it comes from the pectineal line of the pubic bone. And here is how it starts, and then it is going to the pectineal line of the femur. Now this is a muscle crossing the hip joint, and what does it do? Because it is medial, it is going to adduct the hip joint, and because it is inserted anteriorly, it is going to flex, and it is going to medially rotate the femur. Now here is an image where we can build our knowledge brick by brick. Now you know this muscle, this is the iliacus muscle, a flexor of the hip. Then this muscle is the muscle we have just described. It is the pectineus, and it is an adductor and flexor. This is a flexor of the hip, but it is a synergist. It is not as strong as the psoas and the iliacus. And then the muscle just inferior to the pectineus is on the medial side, and it comes from the body of the pubis to insert in the upper part of the shaft of the femur, and this muscle is going to be called adductor. But what size of adductor? In this image there are more muscles added to what we know. The question is, what do we know? This muscle is coming from the anterior inferior iliac spine, crossing the whole anterior part of the thigh and going down medially to insert on the medial condyle of the tibia. Because this muscle is going to flex the thigh, lateral rotating it and flexing the knee. Therefore this is the position where a tailor sits down and uses his needle. Therefore this is called the tailor's muscle. It is the longest muscle in the body, and it is having multiple functions on the hip and the knee, and this muscle is called sartorius. Then let's forget about the sartorius and look into this muscle. This muscle is the third time now we are mentioning it. It is the pectineus muscle. Then if we go medially, so let's erase pectineus. If you go medially, this is a medial muscle on the medial compartment, and it comes from the body of the pubis and inserts on the medial side of the femur. Therefore this is going to be an adductor, and we have several adductors in the human body, and this is adductor brevis. Adductor, you know, this is the description of the function, and it is the short adductor. Therefore, it is called adductor brevis. Now, let's take this out and then come to this muscle. How do I describe this muscle? It is a large muscle on the lateral side of the middle part of the thigh, and extends a long way down to the knee. Therefore, this is called vastus lateralis. It is one of 4 muscles making a group called quadriceps muscles. Why vastus? Because it is large muscle, and why lateralis? Because it's on the lateral side of the thigh. This is the left side of the body, and at this moment you are supposed to know what are these 2 muscles. In case you had difficulty in the previous slide, I will give you a hand. This is the iliacus, because it's coming from the iliac fossa, and this is the pectineus muscle, and medial and inferior to the pectineus is the adductor brevis. I'm sure you have noticed that at least your thigh, that the anterior part is bulky, full of muscles. The most muscles that make this bulk is what is called quadriceps muscle. It is 4 muscles present anteriorly on the thigh, and they share one tendon, and we will come to that later on. One of the 4 quadriceps muscles is what is called vastus medialis. Vastus means huge muscle, and it's on the medial side, and it comes from the anterior surface of the femur and joins the common tendon of the quadriceps. Another member of the quadriceps muscle is vastus lateralis, and you can explain the naming of this muscle. On your left, you can see an anterior view where even it takes origin from the greater trochanter and the anterior surface of the femur, and when it gets down, it joins the common tendon. The figure on your right shows you a posterior view where you can find also the vastus lateralis, because it is so big, you can see it anteriorly and posteriorly. The third member of the quadriceps muscle is vastus intermedius. It lies between the lateral one and the medial one, and it is also a big muscle, and it takes origin mainly from the anterior surface of the femur. The 4th member of the quadriceps muscle is the muscle present in the middle of the anterior part of the thigh, and it is a big muscle as well in length and in width, and what makes us recognize it very easily is that it is bipinnate. That means there is a tendon in the middle, and the muscle fibers are extending into lateral and medial parts. Then we want to describe its position. It is inferior to the sartorius muscle, and in between the vastus lateralis and vastus medialis. the vastus intermedius is deep to it, and the four muscles will form a tendon, one tendon, and it is called the quadriceps tendon. And then in this tendon you find the patella as a sesamoid bone, and from the patella on its way to the tibial tuberosity, it is called patellar ligament. Now we are in the medial side of the thigh, and we can see a large muscle here, and it takes origin from the inferior ramus, and then it comes down to the lower end of the femur and attaches to the adductor tubercle, something you know as a feature of the lower end of medial side of the femur, and it is also attached to the shaft of the femur. This is on the medial side, and it is large muscle, therefore this is called adductor magnus, and you know the reasons for this name. This is a muscle on the medial side of the thigh crossing the hip joint, and therefore it must be an adductor as a main function, and it comes from the superior ramus and body of the pubis and inserts on the middle part of the shaft of the femur, and this is called adductor longus. It is inferior to adductor brevis. This is an adductor brevis. We have met this muscle before, and it is superior to the adductor longus. In this image, you can see that on the medial side of the thigh there is a red marked muscle. This muscle is inferior to the pectineus muscle and superior to the adductor longus, therefore this muscle is the adductor brevis. Where is the adductor brevis? It is on the medial side of the thigh, inferior to the pectineus and superior to the adductor longus. Where are we now? We are in the posterior part of the thigh. This posterior part of the thigh has a muscle group called hamstring muscles, and the red marked muscle is called the biceps femoris. Now we have met the term biceps before when we talked about the biceps brachii of the arm. Here is a biceps femoris of the femur, and it is the lateral muscle of the posterior compartment of the thigh. We are still in the posterior compartment of the thigh, and the red marked muscle is what is called semitendinosus. Why semitendinosus? Because half of the muscle is flesh red muscle and half of it is a tendon, therefore it is called semitendinosus, and it is just medial to the biceps femoris. Now we are in the posterior compartment of the thigh. Now the figure to your left, there is a red marked muscle which is lateral and in the posterior compartment of the thigh, a member of the hamstring group of muscles, and you can see that it is extending from the pelvis down to the tip of the fibula. But when you look at the right figure, you can see a red marked muscle, which is also in the lateral part of the hamstring, and this is the short head of biceps. The one on your left is the long head. Therefore, the biceps femoris has a long head and a short head. Looking at the figure on the left, we can see that a muscle is on the medial side of the posterior hamstring muscles, and we can see that it is fleshy almost down to its insertion, and this is called semimembranosus, and it is deep in its upper part to the semitendinosus. On the right image, you can see that the red marked muscle is the semitendinosus, and if you compare the two shapes, they are a bit different. Now, at this point of time, you have enough information to explain why is the red marked muscle is the adductor longus. Where are we now? We are looking at the posterior part of the leg, below the knee, and we see a muscle that is called gastrocnemius, and you see in the large letters the way it is pronounced. Gastro K, gastrocnemius. Some people pronounce it as gastronemius, but this is what is documented in the dictionary. And why is it Achilles tendon? Achilles is a Roman warrior who, in one of the battles, received an arrow into this tendon, and then when he walks, he cannot push his body forward. Therefore, he depends on the other leg, and there is a foot drop. The foot is shuffling on the ground. Therefore, this is called Achilles tendon, in reference to the name of the Roman soldier. Here is a lateral view of the gastrocnemius muscle, where we can see that it takes origin from a point just superior to the condyles of the femur, and then the Achilles tendon attaches to the superior part of the calcaneum, and when it contracts, it pushes the body forward. And in which region I am looking into? It is the posterior compartment of the leg, below the knee, and I can see a muscle named soleus. Is this the most superficial muscle in this region? The answer is no. It is deep to the gastrocnemius muscle. And if I look at the upper end, I can see that it is taking origin from the posterior surface of upper end of tibia and from the head of fibula. As the muscle comes down, it is going to join Achilles tendon, and this Achilles tendon is going to insert into the upper part of the calcaneum. Here is a closer look and another view at the soleus muscle. Here is a good exercise for you to review and test yourself about what are the muscles making the anterior part of the thigh. You can go through the animations one by one and you can name these muscles. If you cannot name them, then ask questions and look for answers.